and welcome back to Irene the Educator. Today I want to talk about this very, very sad case about Gina 2, her AIDS story, and just show you the before, then, and now. But before that, let's get into the disclaimer. There's so much information out there about AIDS and HIV as well as other sexually transmitted diseases. So today, to not be aware of it or to say you're not aware of it is very strange. The only person today I would not expect to be aware of it is babies or children. But I remember when I was a young girl, I used to read in my sister's books. I know I mentioned it before that I'm the youngest of 16 and the youngest of 11 girls. There was 11 girls in my family. But my sisters used to get these romance novels and these other books that they used to read. And they were just avid readers and puzzle. They used to get those crossword puzzles, and that's what I grew up on, learning how to do crossword puzzles. And we used to sit down as a family, put together jigsaw puzzles and things like that. But they used to read these romance books and these other books. I remember one book that one of my sisters had, and I would read through them. I like read the front, skip a little bit in the middle, then read the back to get to the end. But this one particular book that one of my sisters had, and they shared them amongst each other. One would read one and get through reading it and then pass it on. So like I was saying, this one particular book, it was about prison. A guy, it was a true book, a true story where this guy had gone to prison and he was telling of his experience while he was in prison and what he was seeing. This now had to be about in the 70s because I remember I'm from East St. Louis, Illinois, and we were living on 4th Street at that time. So this had to be in the 70s sometimes when I read in this particular book. I wish I could think of the name of it. But the guy was talking about some of the inmates who were catching this disease. They didn't have a name for it at that time, but what the prisoners was calling it was the disease that the men got who were having relations with other men. And the guy, he used some, what I remember is he used some foul language and things. So for a young kid at that time, we didn't have that in our home and things. But I really remember what stood out was that. And then I started thinking back when I was a nurse in the early 90s, like 91, and then dealing with a lot of the HIV when it was coming on the scene and things, and they didn't really know too much of what it was while I was in nursing school. It was coming out. And so they would, discuss, and then they finally gave it a name. And I thought back to that book I had read. So that's very strange, but I'll visit that some other time. And another thing, the way I became a nurse was I was pre-dental, and then I went to nursing school to be able to save up money to pay for my dental school, but that's a whole nother story there as well. So while I was working on my BSN, I went ADN, which is Associate's Degree in Nursing, and BSN, Bachelor's Degree in Nursing. I had, once I got done with school, and then I was working in the hospital, and then, like I say, AIDS was something new, HIV and AIDS was something new, so I didn't mind taking care of the population of patients that maybe other nurses or other people didn't want to take care of, because, I was always like, everyone deserves tender, loving, compassionate care. So as I'm going on, so I got my associate's degree, then I went and got my bachelor's degree. So I did a clinical, because we had to do community health. So I chose to do it, or applied to do mine at AIDS clinic, and I learned so much during my stay there. One of my preceptors, here I am, this young nursing student, was working on my bachelor's at that time, And she said, well, why do you think it's still prevalent in the Latina and the Black community? Since, she just asked me that question. And of course, my answer was, oh, it's education. And she said, no, try again. So I'm like, well, what is it? And then she said, it's the culture that keeps it alive. And I don't like to say thriving, but that is the culture. That's what she said. It was the culture where people are not protecting themselves, where they're not using precaution. And I'm thinking back to the Gina Liu, I'm mixing the alphabets up, but Gina too, from what she was saying about her case. And no way am I downplaying it or belittling her. I'm glad that she's coming out because it brings more awareness, and maybe it can change what's going on with the youth culture and the revolutionary culture of the freedom that people are operating in having relationships, because you do have to take responsibility for yourself and protecting yourself. So while I'm doing this preceptorship, I learned that there were men who were still saying that they were men and they were having relations with men. They would say something like, oh, I had it maybe a few times last year. And it's just shocking me because they were still with women, and they were not calling themselves bisexual or anything like that. So it just solidified it for me that it was the culture. And a lot of the women that the men say they wanted to protect themselves or use protection, but they were afraid, or they didn't want to hear the woman say, well, are you cheating on me? I'm not cheating on you. So they didn't want to hear the negativity or the rejection from that, or the accusation, or get attacked from their significant other. That is why they said that they did not protect her. And this is the main reason why you have to protect yourself. You have to take that responsibility upon yourself. If you are someone out there and you are having relations, whether you are in a long-term relationship or whether you're married or single and you're just out there, male, female, teenager, whatever, if you are having relations, then you need to take the responsibility for yourself to protect yourself. Or just it only takes one time to mess up. Like even today, back in the day, people were giving blood transfusions and catching it that way. But we know due to the advancements in healthcare, I remember 30 or so years ago, many years ago, that some people were getting contaminated blood, even from babies who needed blood transfusions, and then other people that needed blood transfusion were getting tainted blood. But since the improvement in science of it and finding out that was a cause, the screening processes for that has greatly improved. So the education piece, like I was saying, is there because people know how to get it and people know how to prevent it. When Arthur Ashe came out with it, he was somebody that got it from the blood transfusion. But most of the people that's probably getting it today have had relations and have not been testing themselves. The medication has improved. Back in the day, people were dying because there was no medication for it, or the medication was new. But taking the medication today have extended a lot of people's lives, like Magic Johnson for one. And so after that clinical rotation, first let me give a shout out to my sister who's been very supportive. Thank you so much. And after that clinical rotation, I partnered with AIDS Project LA because I was very moved by trying to do something. So that's the educational piece. One of my nursing instructors had told me to try to merge my talent with my nursing, and that's what came out of that, different poetry, writings, and things like that toward education. And so I'm attaching the link in the description area to the play. Like I said, the church was very forward and supportive as well. My church, Philadelphian SDA Church in Long Beach, shout out to them. They were very supportive in doing the play. The church members, different members of the church did it, acted in it, filmed it. And you got to remember, this is 2005, so we didn't have the technology that we have today. So just keep that in mind. But I did include the link there, and it's fictitious, so it's no particular person. It's just things that were in my head. And also, if you notice in the title, I said I'm using M and D, and M is for Michelle Obama, the D is for Princess Diana, because that will hopefully cause a mental or a mindset change if you can think of those people. Anyone that doesn't know who Michelle Obama is, Michelle LaVaughn Robinson Obama is an American attorney and author, and she was married to Barack Obama. She was the first lady of the United States from 2009 to 2017. She was the first African American woman to serve in this position. Again, she is married, still married to Barack Obama. Shout out. And the second part of this team to get this message across is Princess Diana. Princess Diana is being used for the D. And she was Princess of Wales, was a member of the British royal family. She was the first wife of Charles, Prince of Wales, the heir apparent to the British throne, and mother of Prince William and Prince Harry. So together I am using them to bring awareness to help change the culture and have a better living for everybody. With that said, now you know how the M and the D ties in to this educational piece, or should I say culture change piece. Another M and D is medical diagnosis. Medical diagnosis is the process of identifying a disease, condition, or injury from its signs and symptoms. Oh, let me tell you this other story. I'm carpooling. At that time, I was living in Corona, California, and carpooling to LA, my job in LA, my nursing job in LA. And carpooling, one of the persons I was carpooling with was a farm tech. And he was in the main hospital that was off from the side, the clinic where people went to get their treatment for HIV and AIDS was offside. It wasn't in the main hospital. So what he had to do, he had to pick up the HIV medication and take it outside the hospital to the AIDS clinic. And while he was in the hospital, he was in the elevator, and there was a young lady who was basically trying to proposition him. I guess saw that he was an older gentleman, and then she was trying to proposition him, and he's like, "Girl, get out of here." Basically, he didn't say those certain words, but he was like, "Nah, happily married man." And so he was telling the story, and then he got over there to the AIDS clinic with the medication. And guess who he sees over there? He sees the young girl over there, and he said she couldn't even look him in the face. So here she was trying to proposition this older man, because she was probably like early 20s, and then he was in his mid 50s. So it's things like that. I'm not saying that's what Gina Tew did, but I'm just saying those are the certain things that people have to protect themselves. And so she said that the doctor had told her that she had had the infection for at least 8 to 10 years. And it's reported that she had dated Chief Keef, Chris Brown, and Nick Cannon, or had been seen with them, allegedly seen with them. But she says that she's not giving out anybody names or anything. She's not trying to do that. And she started having certain symptoms, and cachexia is a complex syndrome associated with an underlying illness causing ongoing muscle loss that is not entirely reversed with nutritional supplementation. So those are certain things that you can have, and it requires a medical diagnosis. The symptoms include weight loss, muscle loss, a lack of appetite, fatigue, and decreased strength. And these are some of the things that she started experiencing. So her statement was that she did not know that she had it for the 8 or 10 years, and then she happened to go to the doctor, and these are some things that she was experiencing that made her finally go to the doctor. She was sick, she was fainting, having fever. She said they assumed that she had cancer or cervical cancer, and she had lesions. And then finally a doctor said, "Did you know you have AIDS?" And so not getting checked like she should have, so she did not know. And that's what she's saying, she was not getting checked. And now people are trying to use and throw out stars name that she had been with, because remember she had this time period. So Chris Brown was one of the names that came up, as well as Chief Keef and Nick Cannon. Oh, Michelle, I bet they're kind of shaking in their boots right now. Girl, you know that. So you can just imagine probably the anxiety that's going on right now, because she says she's not trying to throw anybody's name out there or anything, and she's not throwing anybody's name out there. She's just presenting what has happened to her, and then people in the media are the ones that's throwing these people name because their name is going to get attention. So murder and disease, this is another thing I want to put in the mind to try to bring about the culture change. Intentionally passing a disease to someone that leads to death without treatment, as well as untoward health issues, is wrong. And not saying that that's what she did, but it's just you have to take responsibility for yourself. Here's a picture of her before and then after, during the glamorous time. So it's a before picture, a glam picture when she started getting her branding herself, and branding herself basically as an Instagram model. That's what they're saying. This is not coming from me. This is what they're saying. And then I was telling you about the cachexia, and that's like the wasting away. And these are the things that she was saying that she started experiencing and got her attention, to the point where one doctor finally said, "Oh, this is what you have." And then it's really sad because she was getting up in a wheelchair. She's trying to learn how to walk, get her strength back. She had gotten down to like 65 pounds, and she was already a thin person, but she kind of looks skeletal right now. So these are some of the things that you will experience if you do not take responsibility for your own health. And this is what I want to happen, is for everyone to take responsibilities for protecting yourself. Oh, let me tell you this other story. I was working on the neuro unit, and a young lady came in who was pregnant. I don't remember exactly. She was not, I don't think she was past 5 months, but she had already had a young daughter that was a few years old, and then she was about 5 months pregnant. Came in, very, very attentive husband, and she came in with symptoms like neurological symptoms, and she would be lucid, in and out between being lucid, and she would talk. You could solicit the information from her, and she would awake, alert, oriented, and then would go out with making animal sounds. And so started off from regular neuro, and then her symptoms started getting worse, and they're trying to find out. We're scratching her head. The doctors are scratching her head, infectious disease. Everybody's just scratching their heads like, what's going on? And you got to remember, this is before they realized how other people was getting infected and things, because before initially they labeled it as the, I'm just going to say it, the gay disease, but we know now that it's just an opportunistic type of disease. but that's how they used to label it. So anyway, so she's having all these neural problems or neural symptoms, and she's advancing because she's getting worse. And like, what is it? What is it? And they're thinking, getting the history. Toxoplasmosis was coming up because the husband had given a history that, oh, she was feeding fed the stray cats, so they're thinking maybe one of the cats scratched her and things. So as you see, toxoplasmosis is a disease that results from infection with Toxoplasma gondii parasite. Toxoplasmosis results from infection with a common parasite found in cat feces and contaminated food. It can cause serious complications for pregnant women and people with weakened immune system. So you remember that I said she was about, I don't think she was quite 5 months pregnant, but before the fifth month. So this is what they're trying to rule that out. And so as the doctors continue to try to rule that out, and they're continuing doing tests and things, so she's getting worse and worse, end up getting put on the ventilator. So now it's getting worse, and she's on the ventilator. And a ventilator, a mechanical ventilator, are machines that act as bellows to move air in and out of your lungs. Your respiratory therapist and doctors set the ventilator to control how often it pushes air into your lungs and how much air you get. You may be fitted with a mask to get air from the ventilator into your lungs. And now they set the settings. They do what's called an arterial blood gas, and they make sure that you get the correct, like they say, they set the settings so that you get the correct oxygenation. And this is what was happening. So as she got worse, her need for more critical care was warranted, so she was then transferred to a higher level of care. So like I said, the husband, very dedicated, coming there, and everybody's just perplexed. The infectious disease, the doctors, nurses, everybody's just like, what is going on? And finally, she succumbed to the disease that she had, and we found out what it was she had full-blown AIDS. This is why I emphasize protect yourself and personal responsibility. Look at this next information from California from 2017. In California, thanks to California Senate Bill 239 as of January 1, 2017, it is no longer a felony for people who are HIV positive to have unprotected relations and not disclose their status. Again, you see why it is important for you to protect yourself, because even if Q was in California, she didn't even have to disclose her status, even though the doctors reported that she has been infected since about 8 or 10 years. It's the buyer beware. So are you going to put your health, life, and livelihood in someone else's hand? See your healthcare professional. And then there are links to HIV and AIDS in the description area. Just be careful out there, guys. I remember back in the day, we used to use like needles, real needles, and to purge our drips, our IV drips, and we'd have a cap and we'd tape it on to, or insert the needle into the cap that was taped to the IV pole. And we used to have some patients would try to position the needles where the nurses would get stuck on the needle. So you do have people out there intentionally trying to infect someone, as well as those who don't. That may not be the case with everybody, but just a reminder to take responsibility for yourself. And also like, share, subscribe, and leave a comment. And also when you subscribe, you can get notification for the next video. And also appreciation out to Tu for sharing her story. Thank you, guys. Have a great day. Bye.